As COVID cases rise, hospitalizations are starting to pick up speed in several provinces.
These are worrying signs. We know how quickly the virus can spread. These surges in cases can overwhelm public health.
Canada's first wave of severe COVID cases peaked in May, with over 3,000 Canadians lying in hospital beds.
And we're not there yet, but the trend is getting worse and worse and worse.
Right now, 427 people are hospitalized with this coronavirus. Most of those patients are in Ontario, Quebec, and BC.
Instead of one big raging fire, it's dozens of small little fires that are all adding together,
including an outbreak inside this Calgary hospital. This week, 17 patients and 9 staff members tested positive for COVID-19, and over 100 staff members are now in isolation. It's a scenario that scares ICU nurse Kamisha Marshall. She and her colleagues are preparing for the next wave of patients.
My only concern is nurses. We have enough nurses and they themselves don't fall sick with COVID.
According to recent statistics, nearly 1 in every 5 cases of COVID-19 in this country has been among healthcare workers. 12 have died.
Kevin, you got a real busy day. We're ready.
The head of the country's largest hospital network says staff are currently treating patients who've had their surgeries put on hold by this pandemic. He fears time is running out.
Which means we'll have to dramatically gear down our elective work yet again and worry about having adequate people in place to care for the critically ill.
The rise in COVID cases is prompting some provinces to bring in new restrictions. Public health authorities insist it's not too late to flatten the curve. But in the event that it doesn't happen, hospitals are once again preparing for the worst. Christine Virak, CBC News, Toronto.